Hello, my name is Dr. Justin Eckenrode. I'm with the Carlisle Small Animal Veterinary Clinic. Today I'd like to help you learn more about dog, fleas, and ticks. Obviously a very unwelcome guest that you probably do not want. I'm going to be working through a couple questions this morning, helping you understand more about treating and preventing dogs, fleas, and ticks. So first question is, how do dogs get flea and ticks? Typically, these are coming from the environment. Your pet goes outside, even in short and small areas, but they get exposed to the environment, and that's where most of these things reside. They'll pick them up, they can jump onto the pet. Typically, let's start with fleas. They are typically more in the damp, cool areas, so if it's hot outside, you'll find that most pets go sit in the shade underneath a tree, something like that, and that's where these will come on from the environment onto your pets. Only takes one, they get into the house, onto your pet, so it only takes one, they'll get onto your pet, and then that's when things start. Same thing goes with ticks. Ticks will typically sit up, and it doesn't have to be high grasses, it can be low-lying grasses. They will sit up on top, and what they do is a fancy term called questing. They'll actually put little fingers out, and they will get picked up from there onto your pet, and then and get established. Some of them are very small, you wouldn't even know that they are there. They can come and go, and off you see it. So next question here, can fleas and ticks spread from my dog into the home and family? Absolutely. When it comes to fleas, we'll start there. Again, coming from the environment onto your pet, that flea comes on and sets up, they take a blood meal and start the process. That pet comes into the house, especially if the pet is unprotected. They take that blood meal, they lay eggs, those eggs fall off into the environment, and the process begins. They lay eggs, those eggs will then hatch out, jump onto the pet, and it perpetuates. A lot of times we don't find them until the infestation is much higher, so one or two we don't see, but typically as it grows along, that's when I will typically see them, that we know that there is probably more in the process. When it comes to ticks, typically those, again, small, it doesn't have to be large high grasses, it can be something as much as even just a little bit in the backyard. That small tick will come on to the pet, and again, they can be nymphs, so baby ticks basically, up to the larger ones. Will come on, they take their blood meal, they call off, and off they go. So sometimes they already come and go, and we don't even know that they've been there. Next question, can my dog get fleas or ticks primarily because they're an indoor dog? The answer to that is absolutely. So primarily indoor means that they still go outside. If they go outside, they are still exposed to the environment, and as much as we try to treat the yard, do those things, there is still the possibility. I always tell everybody that life finds a way, right? So there's always a possibility for them to pick up that. And again, something that are very small, underneath this, that ride underneath the radar, can become a much bigger problem if we don't use things to prevent versus trying to treat them. So what health problems do fleas and ticks typically cause? We'll start with fleas. For the most part, the biggest issue I find with fleas is flea allergy dermatitis. It creates an irritation or an inflammation on the pet that causes them to chew and causes them to scratch. They traumatize the skin, create what you probably heard as hot spots. That inflammation, that irritation becomes detrimental to the pet, so we have to treat that, but typically trying to get rid of the primary cause, i.e. the fleas. So if we can treat those and prevent the fleas, then we're better off keeping ahead of that dermatitis. There are more serious things, typically in my area we don't see much of, but things like the bubonic plague is spread by fleas. So there are things out there. The other thing that we tend to see a lot with fleas is not so much from the fleas biting, but from the ingestion of fleas. So we do know that tapeworms can be spread primarily by ingesting the flea. So the pet, the dog, the cat that are chewing because of the irritation will ingest the adult flea, and by doing so they can get tapeworms, which are usually the little rice granules that a lot of people will call in and say, hey, I've seen that in the stool, and then we treat accordingly with that. So those are things. When it comes to ticks, there are different varying levels. So Lyme disease is probably the biggest thing we look at when it comes to tick diseases. So So we all know that the deer tick is probably the primary cause for Lyme disease, and they are very small, poppy seed size. So many people don't even know that they're there. They come on, take their blood meal, and then off they go. We typically do not see them, but we will find out down the line that there's exposure there. There are other more egregious things. Sometimes with that we can see, so bigger diseases and stuff, but Lyme is probably the biggest one we look at. Anaplasma or Ehrlichia are other things that we look at specifically for dogs that we test on consistently. I've actually seen an uptick in anaplasma recently within our area. So those will typically harm or cause issues underlying for platelets called thrombocytopenia, that decrease in clotting ability. So that becomes important for things like when you're performing surgery. Again, we want to make sure that we're able to clot and heal from those. So underlying disease that we don't know about is good to detect early. So that's where testing, that's the 40X test you may hear, is something we use consistently and yearly, looking for signs of exposure and trying to be proactive with that versus waiting until there is a problem. So other things that are out there that are newer, and because of the shift in demographics, things like babesia is a tick-borne disease that we will see that affects red blood cells. So again, things that are that can be very egregious if not detected and caught early. And so that we look through things like that. Let's see. Let's see here. Next question. What is the difference between over-the-counter and flea and tick medications? So over-the-counter medications are very abundant. They're usually very cost-effective. Things that you can find specifically. So let's try that again. So what is the difference between over-the-counter and prescription flea and tick medications? So flea and tick medications, there's an abundance of because they are parasites. They are annoying. We can see them typically. And because they cause issues on the pets as well as a hindrance on us as owners. So over-the-counter medications, there's an abundance between flea collars to tick collars. They're usually cheap. So as far as inexpensive, I guess I should say, they're usually inexpensive. Let me try again. So what's the difference between over-the-counter and prescription flea and tick medications? So over-the-counter medications typically are inexpensive. There is a lot of them. And so with those, they're able to purchase those and place those on. As far as efficacy, I don't typically see as great of efficacy when it comes to the collars on pets as I do a lot of the topicals and oral medications. So with the advancements of the medications, we are seeing improved maintenance or prevention in a lot of these pets. So for dogs specifically, with oral medications, I have seen a great improvement when it comes to flea treatment. So it used to be with topicals, with topical medications, we would have to use timing. So if the pet has a hot spot and bathing them, we would have to time when the medication is placed on and then correlate that with bathing, because we don't want to rinse the product off when we put it on. So there was a little bit of dancing that goes along with it. With the oral medications and the discovery of that, it has really improved and taken a big change in our treatment plan. So I can start them on a flea and tick medication instantly, as well as treating the skin, improving that. So I can be much faster and more efficient in treating the pets now than I've ever used to be. The speed of kill, so the ability to get rid of the fleas, is much more efficacious with the oral medications. We're talking several hours versus something that we're waiting on that works down the line. So again, the treatment and removal of fleas, it was really used to be based off of breaking that life cycle, trying to prevent those adult fleas, killing them, but also preventing those eggs from hatching out and moving on. Now with the oral medications, they are very good at killing the adult fleas much sooner. So therefore, no eggs, and then that life cycle breaks much faster. And again, we're seeing that improvement. So again, the prescription medications tend to be a lot better. As far as ticks, same thing. A lot of the oral medications now are based off of speed of kill. The faster you can kill that tick, the longer that they are attached, the more likely they are to pass disease. So the sooner we can kill them, the sooner they're dead, the less disease that's problem. So the ones that you don't see that are on there that die faster, again, no issues. So again, if we can stay consistent and do that, so then they tend to be much safer. So I tend to find a bigger bigger improvement with the oral medications than I do with the topicals. That's not to say that the topicals don't work. They still do, and something is better than nothing. So I do recommend that for animals that don't tolerate them and can't take them. But again, I do see a bunch of improvements when it comes to, or good improvements when it comes to the topical, or I'm sorry, I do see very good improvements when it comes to, or let me change my words. I do see a lot better efficacy when it comes to oral medications than I do typically from the topicals. But again, it doesn't mean that they don't work. It doesn't mean that we won't have any issues with them. Both medications have pros and cons, but my biggest thing is that compliance is probably, let's go down that pathway. So compliance is probably a big thing that I see. So topical medications, again, we have to get the pet, remember to place it on. With the oral medications, we can typically give them and keep on moving. So compliance with the owner is probably one of the bigger things I also see with that. So by giving that medication orally, you can keep on moving versus having to put the topical, set them aside, make sure it's dry before you go out. With the oral medications, you can give it typically and keep on moving, which is, for someone who's very busy, has kids and everything else, that is a huge plus for me. So next question, typically, or question is the difference between flea and tick medication. So oral medication, I've kind of touched on that a little bit. So with the discovery of these oral medications, and there are several, that when you give those, again, typically monthly, except for one product that is given every 12 weeks. The efficacy, for the most part, is very good across the line. There's some small nuances between most of them, but a lot of times, again, compliance is probably your biggest thing. The medication doesn't do very well if it sits on the side of the pet. If it's given consistently when it's supposed to the pet, efficacy very much improves. So we will see an improvement in the treatment. So again, back to fleas, with a several hours quick onset of kill, if they're given consistently and you're looking to break that life cycle, so that is adult fleas that come out that are on the pet, if we kill them within the first couple hours of applying or coming onto the pet, then they don't have the chance to lay eggs, and we reduce that possibility of flea infestation secondary to that. Same thing again goes with ticks. When we give that medication consistently, that tick that's on there dies within the first few hours. If it dies, it doesn't get the chance to pass on diseases, and therefore better improvement, better quality of life, and less disease processes for the pets. Topical medications, again, several that are out there. Timings have changed. Usually it's monthly. There are a few out there that can go a little bit farther out topically with that. Again, placing it onto the skin is important, putting the whole product on based off their weight, being consistent in the timing. You worry about when you put that on, we don't want to touch it or let it dry. A lot of the medications are now drying faster or improving on that. So again, the timing for it has very much improved. And again, the orals tend to be much more or less problematic. Meaning that the oral medications tend to be, at least from my perspective, as far as efficacy, tend to work better. The topicals just have the possibility of running off or rubbing off, or applying it, or because it takes a little more time, we apply it, or we miss a couple days because we have to time it. You're busy during the week, but better on the weekends, so we skip a few days to apply that. Whereas the oral, when we remember it, the day that it's due, we can just give it and keep moving. So again, I really seem to prefer the oral medication as long as the pet can tolerate it. And those are discussions having with your veterinarian is a good idea to make sure that these are appropriate for that pet for whatever may be happening with them. Collars. There are options that are out there. Some are much longer acting, and then some of the other ones that we put on. I see a lot of people put collars on and leave them on for longer extended periods of time. So I will ask people, like, how long have they been on, and they're not 100% sure. So we wonder, okay, how much of that efficacy is wearing off over time? So if we're not on a set schedule and we place it kind of a set it and forget it, we might lose that efficacy, assuming it's still going to do its job, and maybe we've lost some of that as we move along. So So collars are hit or miss again for me, because I feel like when they're placed on, especially for someone who's very busy, if I don't write down when I put it on or when I gave it, if I don't set a routine, then I will lose that and forget. And then we get down the line, I'm like, well, and then due to the expense of the medication or the collar that we're putting on, I might go, well, I'm going to give this a little bit longer and then come back to it. So again, we start to wonder, where do we lose some of that efficacy as we move forward? So I'm not a big collar person. I feel that the oral medications are a little bit better than the topicals, and a lot of it is based off of compliance, and then the newer medications, they just tend to work more efficiently. So what will my veterinarian recommend for a flea and tick treatment? That really depends on your region. So for us specifically, again, judging by our conversation, is I will tend to recommend more oral medications because of what we just talked about, the efficacy, the use, and what I have seen clinically in the practice, that I have had less conversations with fleas and ticks, and even for feedback from clients. They said, hey, we've given this medication orally. When I did see a tick, it was already dead. Or we have a pet that had fleas, was diagnosed here in the practice, started on those orals, and within several months we're starting to see a decrease in the amount that's there. The pet is less itchy, if that's what they presented for, and therefore we're treating the primary problem, and so the medications are working. So typically it depends on the environment that the pet is in, the situation that you're in, for what we're seeing specifically, and what your lifestyle is. Are you with a dog that goes outside consistently? You're camping more. Are we more exposed to some of these things than the animal that does just go in the backyard? Doesn't mean you don't need it, but you might tailor it a little bit for that. Sometimes it's financial, and like I said at the beginning, is that something is better than nothing. So we will talk through those things typically during the appointment as to what works best for you in the situation that you have, and what we're trying to treat or trying to prevent. Some people are very much focused on flea treatment because we need to they want to stay ahead of that, or they've had an issue in the past that we're trying to stay, or they currently have something. And then other people are worried much more about ticks because of their lifestyle. They're outside, they're doing more, and so that begins to be a bigger issue for that. So next question is, how can I identify fleas on my dog? Fleas on dogs tend to be most found around the lumbar region or the back end of the pet. So tail base, when I get most of my issues, I will see hot spots and stuff typically around that rump area. The easiest place I find to locate fleas, if I can't find it in that area, is to look under the belly where there's less fur. It's much easier to see specifically for fleas, and all I got to see is one run across there, and I know we have more going on than just that. And again, it only takes one flea to get these guys to be itchy. That's the most common spot we'll find fleas. So if I'm looking, that's where I go. Doesn't mean you can't find them up around the head or the neck or anywhere else on the body, but typically if I'm looking, that's where I'm after. Best way to look for fleas typically is to take that coat and take your fingers and run the hair backwards. It will lift up that hair a little bit and allow you to see the skin, because again, fleas don't ride on top of it. They're usually running on the skin below the surface. So by running those fingers backwards, it will pull that hair, kind of part it up, and you can see. We'll also look for things like flea dirt, which is flea poop. The little black specks, if I start to see those. To identify those, the best way I found is to take a paper towel, and if you can comb some of those out and put them on a paper towel or a tissue, add some water to it. When you reconstitute it, that blood will kind of run as a kind of a little bit of a rust color when you put those on there, and so that way that'll help me identify, hey, I may not see a flea, but I see the poop from them, which tells me that they were there, and so then that will help me work with that. How can I identify ticks on my dog? Ticks are typically, because of how pets will pick them up, typically are more found on the head, the ears, the shoulders, neck area. So if you think about how we get into them, they are usually out in the environment. They're sitting up on the top of the grass where they're putting those little feet out there to get picked up. And what goes usually first is the head and the neck and all that stuff going through. So ticks are less discriminatory. They don't worry about moving around. They want to find the best area specific. So as soon as they're on, that's where they attach. So typically face, ears. There's a little pouch on the ear with dogs that we'll look into. So again, they can be very small, but we'll find them on the muzzle and around the neck area. So that's typically where I'm looking for ticks. So the opposite end for fleas typically is where I'm looking. So, what should I do if I see fleas or tick in my dog? Basic thing there, if you're seeing them and you're having issues with them, best thing I can tell you is call. Give us a call. Let's get your pet in because, again, as our discussion before, is that individually there can be different reasons why we will want to treat them. Again, what's your lifestyle? What are you seeing? Even in the dogs that I talk to people that go outside for seconds to go to the bathroom and come back in, I have found tick disease with those. I have found ticks on them. So it does happen. Again, life finds a way. There's always a possibility and a risk, and our goal is to see if we continue to prevent and if we continue to prevent infestations then we have better lifestyle for the pet and for us as owners. No one wants fleas running around the house and or ticks if we can help it. So if you have any questions regarding fleas or ticks, to end that, if you have any questions regarding fleas or ticks, just to end our conversation, I appreciate your time. If you have any questions regarding fleas and ticks, please give us a call. We want to help, and let me see if I can do this without reading off here. We want to help your dog remain flea and tick free. If to end our conversation today, and I appreciate your time, if you have any questions regarding fleas and ticks, please give us a call. We absolutely want to help you with your dog, you and your dog. So let me try again. I appreciate your time today with our discussions on fleas and ticks and dogs. If you have any questions regarding them, please feel free to reach out and give us a call. We want to help your dog remain flea and tick free as long as possible. We're here to help. Thanks again.